Officers are Doctor of Pharmacy graduates who have written and passed the Ghana of Pharmacy Professional Qualifying Examination and have been duly inducted as pharmacists after 6 years of rigorous education and are required to undergo a mandatory housemanship to fulfill all what is expected of us. The housemanship is not just a requirement anyway, it is a crucial phase in our professional development where we apply academic knowledge in real world clinical settings, ensuring the safe and effective use of medications to improve upon patient outcome. So, if a patient is diagnosed with hypertension, and concerning anything drug related concerning their medication, it is up to the Pharm D House Officer to educate such a patient. Sometimes you just hear hypertension, diabetes, and this goes over your head, and you're like, oh, these are big words, these are big diseases. It is up to us to break it down to you how you're going to take your drugs and how, in the long term, whether the side effects or the safety of the medications are going to affect your health and your overall outcome. Patient education, that is for patient education. We also have interdisciplinary collaborations with the medical doctors along with the nurses, in ensuring that patients receive the highest standard of care, which directly impacts the health and well-being of our communities. However, despite successfully completing the phase, the allowances that are rightfully ours have not been paid, as you already know. For clarity, these allowances serve as our legal remuneration as house officers, akin to a salary. So this delay, which has stretched for almost 2 years, after relentless pursuits, I think we completed school back in 2022. Ideally, from 2022, January 2023, we are to start with your housemanship. Here is the case we are in August 2024, and we've heard nothing about remuneration concerning, even though we are done with our housemanship. So many of us come from humble backgrounds where our families have sacrificed immensely to see us through this journey. They hope that by now, after all the hard works and the sleepless nights, we, their children, will be able to stand on our feet. But then here is the case that we end up depending back on our parents who have, I think, at this point, think they are done with whatever they have to do for us, full of hope and dedication. But now, we face the grim reality of being neglected by the system we have sworn to serve. Today, we stand united in demanding the immediate action from the Ministry of Health and all the relevant stakeholders. These are our demands. One, we demand the immediate disbursement of all our standing allowances that is due us. The pursuit of our financial clearance for almost 2 years has been long overdue. We demand the Ministry of Health immediately resolves the matter with the Ministry of Finance to initiate the release of funds owed to us without any further delay. We have fulfilled our duties and we have earned this compensation. 2. Implementation of strategic measures to prevent future delays. On the back of similar incident with our immediate predecessors, we least expected that we would have to visit this unfortunate chapter again. For worse off in our case, we call on the relevant authorities to establish a transparent and efficient system that ensures timely disbursement of allowances for future cohorts of the Pharm D House Officers. We are ever ready to offer our support if called upon. We are here today not just for ourselves, but for every parent who believes in the promise of a better future for their child, for every student who dreams of becoming a healthcare professional, and for every citizen who relies on a functioning and compassionate healthcare system. We did not become Pharm D House Officers to get rich. We became Pharm D House Officers to serve. But we cannot serve effectively when we are burdened with the financial strain and emotional distress. We ask